I did not realize how much my choice of hospital for this little girl's birth was going to impact everything in our life from here on forward. I guess I had a placental abruption, which is when the placenta detaches from the uterine wall, leaving the baby without vital nutrients and blood flow and oxygen. I was going to need an emergency C-section. That baby's heart rate was decelling with every contraction.
About 55% of our C-sections were emergent, not the scheduled kind. And so the more patients you have in labor, the more the possibility rises for C-sections emergently.
The fact that they knew what to do and when to do it was outstanding. And I think that obviously the choices that were made and the way they went about it was exactly what needed to be done.
I think Finley right now is dealing with what they have, and they're doing a great job with it.
Yeah.
But I think that there's obvious concerns that need to be addressed, and I think that can be addressed with a new suite.
So we have a C-section room that is antiquated, I would say. It's done a good job of doing what it needs to do, and our staff work well within the restraints of it, but there are updates that can be made that would enhance the flow, mirror the care that our nurses give.
I think updating the equipment as well as the room would benefit us a lot. I think the workflow would be better, which would make everything more efficient if it wasn't so crowded and so many people in one small area.
Ideas that we have is changing the flow in the room and the position of the mom so she can look over and see the baby. Positioning cameras and television screens so that the mom can see the baby when it's on the warmer if it can't be on her chest at that moment. So just little things like that so the mom can bond with the baby sooner and make it more like a vaginal delivery and the bonding that occurs as compared to just a C-section where I don't get to see my baby and it leaves the room.
I think updating the space also for us would be beneficial in having better storage so things aren't just laying around and it's not so crowded for the techs and the nurses that are trying to get us things when we need them.
When you're in the C-section room, you can see there are movable storage units and they don't all match. You know, it's just whatever we have available at the time. So we're really looking at getting built-in matching storage. You know, wipeable stainless steel, booms that come down, medical booms from the ceiling so that it will house all of the equipment that's needed for the C-section or the operation that they're doing.
We have a spot where our dads wait while mom's getting their anesthesia, and it's a pretty old room that the dad's sitting in right next to our scrub sinks, and so I think updating that area would benefit them and their perception of the area a lot.
Some of our equipment in there is before my time. The scrub sinks were from 1950s, and so I think that's been one of the biggest asks that I've had is, can we please get updated scrub sinks?
The disadvantages of the C-section suite are definitely the fact that there's only one entrance.
The workflow is not ideal where you have to walk around the mom and all the sterile equipment to get back to the baby. What we're looking at doing is completely flipping the room, and so right immediately when you walk into the right is where the baby is, and they could have their own personal door so they don't have to compromise the mother's sterile field, disrupt the surgeon performing the surgery or anybody else that's already working with the surgeon in the OR table.
I think that updating the area and updating the facilities would just help with patient satisfaction, staff satisfaction, and the way that they perceive the area.
Because of Finley's quick actions, Gwendolyn is going to grow up to be a completely normal and happy child.
When you deliver here, we treat you like family and you really do become part of our family. Please help this become a reality. Join our family and help us reach our goal.